If you're watching this, I'm sorry. Back pain sucks. It's no fun at all. On top of that, it's a pain in the ass to pinpoint the source of the pain. My name is Mark Musson. I'm an interventional pain physician. When we see a new patient, we want to know if they're having back pain only or if they're having back pain associated with pain shooting down the leg. Sciatica is a symptom. It's not a diagnosis. It simply means pain shooting down the leg. Sciatica does not mean nerve injury or nerve damage. So knowing whether or not there's pain shooting down the leg with the lower back pain, it helps us along in the diagnostic pathway. So if someone presents with just lower back pain, nothing down the leg, there are 5 common problems that we see with this. Number 1 is disc pain. With wear and tear, you could damage the outer fibers of the disc, and that can be a source of pain. Number 2 are ligaments. The ligaments in the back can be damaged and injured, like a sprained ankle. You can sprain the ligaments of your back, and these can cause pain right in the back itself. Often these don't heal well and can linger for years. Number 3 are the facet joints. These are joints that connect one vertebral level to another. They can become arthritic, they can become inflamed, they can become painful. Number 4 are the SI joints, or the sacroiliac joints. Like the facet joints, these can also become arthritic and painful and could cause pain in the back and more in the buttock region. Number 5 is a compression fracture, either from an injury or a fall, or even if someone has osteoporosis, you can have a spontaneous compression fracture and have pain right over that site. Okay, now we're going to jump to the common problems we see with pain in the back with sciatica, or with pain shooting down the leg. Okay, number 1 is radiculopathy. This is nerve pain related to the nerve root as it exits the spine, being either compressed or pinched from either a disc or even the arthritic joint. So you can either just irritate this nerve root with some inflammation in the genital area, or if you compress it, you can start damaging the coating in the nerve. If you continue to compress it, you can start damaging the nerve fibers. So depending on the severity of the compression, symptoms may present differently, even as much as developing weakness and paralysis in the leg. So often we see with this, there's a referral pattern down the leg that follows a dermatome, or this patch of skin that is associated with that specific nerve. The next 3 actually fit under back pain only. Depending how they present, they may actually have no leg pain, or they may have leg pain. So the second one is ligament pain. So these ligaments, if they're bad enough, can cause pain referring down the leg, referring down into the groin. Some of these will refer even all the way down to the foot, and can mimic pain from a nerve root, or the radiculopathy. Number 3 is the facet joint again. So if these are inflamed enough or painful enough, they can cause referred pain down the buttock, down the back of the thigh, and usually doesn't pass the knee. Number 4 is the SI joint again. Again, kind of like the facet joint, if it's bad enough, it can cause some referred pain, typically down the back of the thigh. It doesn't typically go all the way into the foot. And in my opinion, the SI joint seems to be less often the problem in that region. Typically what I see is that the sacroiliac ligaments are actually more problematic than the SI joint itself. Number 5 is piriformis syndrome. This is where the sciatic nerve is compressed by the piriformis muscle, or sometimes the sciatic nerve will actually pierce the piriformis muscle, and it can be easily compressed. So this is actually true irritation to the sciatic nerve. This is actually quite rare, but if it's bad enough, we can see some swelling of the nerve on MRI, or we can see some nerve damage associated with that compression of the sciatic nerve on electrodiagnostic testing. There are many other causes of lower back pain, but these are some of the most common things that we see, and specifically relating to back pain that's significant enough to warrant going in to see a doctor. Feel free to comment below if there are any back pain or pain related questions or topics that you want me to discuss. Otherwise, make sure to subscribe, and until next time.